Hi, my name's Seb Gray. I'm a paediatric consultant from Salisbury and the Children and Young Person Asthma Lead for my ICS, which is Bath, North East Somerset, Swindon and Wiltshire. I'm here today to give you some top tips for tackling the impact of health inequalities in children and young people with asthma. So the core 20+5 focuses on the most deprived 20% of the population, and this is the children's and young people version, because we know there's health inequalities. And I was delighted to see that asthma was included, not just included, but number one. We know that all the possible measurable outcomes for asthma are worse if you live in deprivation, whether that's actual death rates, admission rates, unnecessary medication rates, all the metrics that we measure, asthmatics who live in deprivation do worse. And so we need to try and tackle it. So I've got 4 top tips that we're going to run through on how to do this. Number one, we need to be able to identify children and young people that live in poverty. And there are a couple of ways to do this. Firstly, we can use the index of multiple deprivation and check people's postcodes. Now, this is quite crude, but it does generally work quite well. So we can be able to do this. You just type in the postcode and it tells you whether they live in the most deprived or the least deprived or somewhere in the middle. Secondly, the fantastic WHAM project, the Wellbeing and Health Action Movement, have developed some screening questions. Have you been worried that you wouldn't be able to pay your bills? Have you been worried that your food would run out before you had money to buy more? Have you had any problems with your housing? You ask this and ask where this has happened in the last 12 months. If the answer is yes to any of these, it's a simple way to identify those that might be living in poverty, and you can then signpost them to the resources that they might need. Number 2, learn more about asthma and poverty. I've collated everything that I know and I've learned about understanding health inequalities relating to poverty and asthma and put it into a paediatric foment blog. The link's below. There's also some fantastic national education packages that have been developed for anyone that comes across any child and young person with asthma. And asthma and poverty are interlinked, but we need to understand much more about it to be able to help people and point them in the right directions. Number 3, tailor the advice that you give for individual patients. There's loads of resources out there. Again, the WHAM project has developed some of the best signposting to the national resources available, and all the links are there. Healthier Together, likewise, a brilliant website that signposts to fantastic resources. But you need to know what's out there for your local population. To speak to your local authority, speak to your councils, find out what's available for your local population so you can signpost appropriately. Fourth and finally, you need to advocate for your patients, whether that's writing letters to support moving away from mouldy, damp conditions, whether it's joining the Royal College of Paediatrics and Child Health Parliamentary Panel, the link's there attached to the Houses of Parliament, whether it's upskilling your own personal skill sets by doing Making Every Contact Count e-learning for health packages, or very brief interventions for smoking cessation courses, both of which the links are there, or learning more about the WHAM project, which I'd highly recommend. Scan the link and join. Asthma and poverty are interlinked, but there are things that we can do to try and help. Try and make things better for those that are living in poverty and that have asthma, either now or about to get it because of where they live. Scan the link to find out more, and thanks very much for listening.